Hello, everybody. My name is Troy Trigstead. I'm the editor-in-chief of Pharmacy Times. Today, we're going to do a live virtual webinar on the coronavirus COVID-19 response. We're going to be focusing today on both work change and life change as we're all going through this national necessity of stay at home, but also provide healthcare to millions of Americans. So thanks for joining us. On our panel today, we have a great panel today. We have Dr. Susie Solomon, who's the founder of the Pharmacist Moms Group, a very popular group online. Thanks for joining us, Susie.
Thank you.
We also have with us Dr. Darren Degree, who's the Senior Director of Pharmacy Operations at Walgreens. Thanks for joining us. And Lauren Simcoe, who's the Managing Performance Specialist for Pharmacy Development Services. Welcome, Lauren.
Thank you. Thanks for having me.
And last but not least, we have Jeremy Sasser, Pharmacy Content Strategist at National Health Career Association, with probably some very interesting perspectives. Thanks for joining us, Jeremy.
Thanks a lot for having me.
So I want to just do a quick round robin across the group here. So maybe January, probably a little February, certainly into March, all of our lives changed, regardless if we were in healthcare or not. We're all in healthcare, so it was an extra change for us. Let's start with maybe Susie. Susie, tell us a little bit how all of this has changed your daily life, your work life. As you sit here today, what do you know now that you didn't know 3 months ago?
So for me, I did work from home a lot before. I've always been in industry or in academia, so my career was flexible, but this really just changed everything with having my kids home with me. We also had to cancel a couple of Pharmacist Moms events prior to, back in February with things. So things have just changed, and now everybody's on Zoom, and it's, a lot more comfortable.
Thank you. Yeah. And so Darren, Walgreens is obviously a big company, thousands and thousands of stores across the country. Maybe for yourself, tell us how work's changed a little bit and what you're doing. And then also, how's it changed for the thousands and thousands, tens of thousands of staff at Walgreens pharmacies?
Yeah, you know what, let me start with the team members in the store. So obviously, just trying to figure out how to take care of our customers and patients. And trying to meet them on their terms, right? So obviously we've tried to do a lot of changes around delivery services, trying to make sure that they can get the products and prescriptions that they need through the drive-through or extending the drive-through options. And then personally, I mostly went into the office every day, so it's been a change as far as just working from home. But it's been a good change too, because I get to see my family a little bit more, and I have 2 young kids, so that has been a positive.
Excellent, thank you. Lauren, tell us a little bit about your work and how it's changed.
Sure. So I work for Pharmacy Development Services, and we are a company that supports independent pharmacies. Personally, I too work from home. We've had some changes in the company in regards to trainings. For example, we host live trainings on site, and we've had to cancel those, postpone those. When we work with the independent owners, of course, similar to what Darren stated, is we've had to assist them with adopting policies and procedures and changing the way that they operate every single day, in addition to helping guide them with all of the information that's coming out from a national perspective, from their state perspectives, and just trying to compile all of that. And then changing back to myself personally, similar to the others, I have 2 teenagers now at home that are working, one in college, one in high school. And so adjusting to sharing that time and making sure that I'm in my home office and they're in their respective areas while they're working on Zoom as well. So it's been a big change for the company, for personally, and all around just in pharmacy. Thank you.
So Jeremy, you may have a somewhat unique perspective for us. Tell us a little bit more about your work and what the Health Career Association does and your broader take on what's happening across the healthcare system. And then of course for yourself as well, how's this impacted your daily life and work life?
Yeah, I mean, similarly, making the transition to working from home, and I have 3 young children myself. And in fact, just this past weekend, had a bout of acute appendicitis in my 6-year-old that we ended up having to have an emergency appendectomy. So I've never had to wear a face mask for 15 hours straight in my life. So that was kind of a unique situation for sure. But, you know, we support a lot of educators across the nation as they prepare students to get certified to be a pharmacy technician. So we've really had to scramble to do everything that we can to help and support them in transitioning their programs online, but then also looking at helping the certification holders that we have that are practicing on the front lines, and supporting them in every way we can. It's definitely been a unique situation where we've had to attack that from both fronts. So it's been quite a change, but there's been some good things that have come out of it too, for sure.
All right. Well, thanks for that. Let's talk about pharmacy technicians. So, Darren, how many pharmacy technicians does Walgreens have, as a for instance?
We have about 45,000.
45,000 pharmacy technicians. Tell us about, how do you inform, educate, train, deal with PPE, changes in workflows? Give us a sense of what that daunting task looked like. So you've got thousands of pharmacists who obviously, need change, but a lot of folks didn't realize there's this huge workforce out there, right, Jeremy, to your point, that is supporting pharmacy operations beyond the pharmacist.
Yeah, I mean, we say this way, behind every pharmacist is a really good technician. And that has been not just for the technician population, but also for everybody in the store, just educating them around social distancing, around proper use of PPE. And then something that we really discovered, due to this social media time frame, or the life that we're in, there's a lot of information being either pulled or pushed to our team, to our team members or our employees. And so, trying to make sure that they have the facts and utilizing good, CDC guidelines or the World Health Organization, and making sure that they understand what is actually fact versus, I'm going to call, fake news. And that's really been an interesting dynamic with this whole pandemic, just trying to make sure that we educate them on what actually is true versus what's not true. And being as transparent as possible with the teams and also their leadership teams actually helps cascade that information so that they feel comfortable in serving the patients that we do every day.
That's a really interesting point. Lauren, you're in the education space and practice transformation space as well. And this idea that, the problem that Darren described was, here's official communications coming across to 40,000 plus staff, and then thousands and thousands of pharmacists. But it's particularly for those 40,000 staff that may not have a 6-year degree, you're competing with their social media feed that they're getting, right? So they're having this information accessible to them all the time, telling them, you don't have any control over that as an employer, right, Darren? And so you're saying, here's my communication, and here's the thousands of communications that are coming to my staff that may be copacetic with that, but maybe in conflict as well. Lauren, what's some advice you might have for companies, pharmacy owners, et cetera, out there about how it is you communicate with your workforce, both with respect to their own workforce protection, but how they also protect patients?
Sure. Yeah, that's a very valid question. And that's something that we've been discussing with our independent owners, the pharmacists, the technicians, the teams. And a few of the things that we advise here at PDS when we talk to the individual owners mostly is to keep the communication open, number one, right, with the teams, understand that this is a difficult time for everyone involved, especially our staff. We're on the front lines of healthcare, and when we show up to work, we are the representative of the pharmacy that we're working in, but we're also representative of healthcare in general. So number one, be open to taking that feedback from your team that they might be scared or uncertain or having some negative thoughts. And the second is provide that education to them, just like you said, making sure that they're able to have valuable information at the pharmacy, to be able to talk to the pharmacist, to share the legitimate information that's out there and not relying on social media. And then the third one is we've had some instances where we've had to shift some roles within the pharmacy, and luckily within independent pharmacy, we're able to do that. So for example, we've had some delivery drivers who maybe don't feel comfortable or maybe are immunocompromised that have had to shift to working inside the store, maybe helping clean or helping sanitize versus being out delivering. So there's been some open conversations like that have helped the pharmacies so that they're still able to show up to work productively and protect their patients.
Susie, can I lean on you for, thank you for that, Lauren. Susan, can I lean on you for this well-being conversation? So what sort of nuggets are you hearing out there, out across the country or around where you're at, even in your neighborhood there where you live, about where pharmacists and pharmacy staff are with, because it's really is a trifold thing, right? I've got my work, I've got my home life, and now I've got this additional sort of stressor scenario, which could throw my regular daily balance off with work as well.
Yeah, I think pharmacists are stressed. Pharmacy technicians are stressed. We had an anonymous question posted in our group today about even hiring. They're short staffed. They need to hire technicians. And they said, you have the person you hire quarantined for 14 days before you hire them, because you don't know if they were exposed where they were previously working or what's happening. So there's stress there. There's stress at home, with the kids being home. A lot of the first line workers are coming home. They don't want to sleep in the same room as either their spouse or their children. And there's all of that stress as well. So there's a lot of depression, anxiety going on amongst a lot of the pharmacists I get. This week I had at least 30 anonymous posts related to depression and anxiety in the pharmacist. And, just with their work and trying to balance how they're still trying to educate their children, because that's a lot of work in and of itself for those of us who are parents. I mean, it takes me hours. Right now, my kids are on recess time. So, I can imagine going to work for that shift and then having to have childcare. Some of them are also married to either a physician or pharmacist or someone else who is an essential worker. And so there's a lot of stress and anxiety and, amongst pharmacists.
Can you offer one or two ways maybe that you're suggesting folks cope with that?
We've done some meditations. We've done some group meditations. I think looking at positive news also helps. Doing journals, grateful, talking about what you're grateful for. We're still able to work. We have employment. One of the positive things that came out for pharmacy as a whole, as a profession, is, being able to actually test. I think for the profession, that actually is a step in the positive direction. I think there are a lot of positive pieces to this for the profession, but I think just trying to stay grateful and remembering that you don't have to do it all. When I see people saying, I reorganized my closets and I redid this, and I mean, I'm just happy that I'm able to cook for my family and do the dishes. And, so I don't think we need to over stress and overcomplicate ourselves with all these Pinterest posts that are showing, you can reorganize your shoe closet today, and don't put that pressure on yourself. I think that's one thing we have to remind ourselves, that we do not need to be doing that during a pandemic.
Well, thank you for that. Let's maybe talk about that perhaps win for the pharmacist profession, but also for pharmacies generally. And Jeremy, maybe chime in after Daram. What's Walgreens' thoughts, or your thoughts individually, Daram, on HHS's called a statement, maybe more than an announcement, around point of care testing and coronavirus?
Yeah, I mean, I think, just following up from Susie, it's a big win for the profession. I think we've always, and we've been fighting the fight as far as getting provider status and these type of accreditations in the past. And this actually helped us move forward. Now, I think it's still a very fluid situation. So obviously that's a great first step, but now we're going to have to work with the states and try to figure that out. But again, I think that just reinforces that, hey, the pharmacist is the closest healthcare professional within the community. And now hopefully it's a first step, but I also think we still have a little whiles to go to kind of have a really, have the pharmacist be embedded within our patients' healthcare.
Yeah, thanks for that. So Jeremy, can you speak to, as pharmacists are becoming more accessible as providers of services, how is that affecting the technician market space and education and training and certification? Whether it's point of care testing, immunizations, care management like functions. So as the pharmacy becomes a healthcare hub, How does that relate to the technician's education, training, and certification? And then also, has coronavirus COVID slowed that down, sped it up? What's the effect of this outbreak we're going through?
Yeah, I mean, I think out of this unfortunate situation, I mean, it's really been a catalyst to highlight the capabilities of our pharmacists and pharmacy technicians. And, you know, obviously as pharmacists increase or broaden their scope of practice and what they're able to do, technicians have to be right there to still be providing technician product verification. They still have to be dispensing medications. You know, unfortunately, things like diabetes, hypertension, these things don't take a vacation during a pandemic like this. So in addition to what you're dealing with patients that are directly affected by the virus, you're still having to do all of the other services that you were providing before. So, you know, I've been watching states slowly broaden the scope of practice for pharmacy technicians. Obviously, Idaho was a big one where they went all in and followed more of the medical model, and gave pharmacists more delegatory authority to you know, delegate tasks to pharmacy technicians as they see fit. And you know, pharmacies stand ready. They're able to do this. I think the point of care testing, you know, the ability for pharmacists to do that. Technicians are going to be there to support them in that endeavor. So unfortunately, pandemic isn't something that anybody would want, obviously, but again, I think it just highlights the capabilities of pharmacies that people are just probably now, the layperson is just realizing.
Yeah, we're starting to hear terms like critical workforce, essential workforce, and it's starting to, in some ways, it feels like reframe in the public's eye what pharmacy, pharmacists, and technicians are. For the technicians out there, there's sort of the corollary is that respiratory therapist or that ED nurse that's now being popularized, rightly so in the media, that we're starting actually to see the media recognize pharmacy a little bit differently than before. What are your thoughts on that, Lauren, as far as a lot of your clients are hyper localized, right? A lot of local Facebook feeds, local media. What are you seeing out there as far as anecdotally how the average person in the street might be seeing pharmacy a little bit differently today than they did mid-January?
Yeah, that's a great question. And I think in some ways, pharmacies, pharmacists, pharmacy technicians have always been respected, right? We've been valuable healthcare providers for a lot of the population, but to your point, it hasn't always been nationally recognized to the same level as some other healthcare providers. And now what we're seeing is that so many of our staff in the independent pharmacy sector are doing things above and beyond. And for example, yesterday I spoke to an owner who he takes his delivery car and takes it to a locally owned restaurant once a week, parks it in front of that restaurant, and then provides meals to his staff to thank his staff for working during this pandemic, but then also purchases gift cards for the community. So he's helping his patients with some food. And during these times, as we know, there's a lot of people that are laid off and unable to afford the typical meals for their family. And he's supporting another local business. That's just a great tie-in. So by him doing so, then his pharmacy is being recognized and therefore elevating the status of, it just goes to show that not just the owner, but the pharmacist and the technicians are there. The other side of that is the pharmacy technicians are having a lot of interaction. For example, a lot of them are being runners now. And what we mean by that is when the front of the store may be closed because of certain areas highly impacted by COVID-19, the technicians are running out to the cars in the rain and you know, weather conditions and whatever it may be, and going out to the car and delivering that straight to the patient. They don't even have to get out of their car. And people are seeing that and really impressed by the fact that these workers are willing to do that. And in sometimes with lack of PPE in some cases. And so these workers are, especially the technicians, are exposing themselves to help their patients. So just some examples of how it really is changing perception of what pharmacy does.
Sure. Yeah. So maybe to the whole panel, what's the most creative anecdotal solution or activity that you've heard about or seen about out there as a workflow or service offering adjustment to the COVID-19 response?
I would just say, I mean, not that anything unique or profound, but during this time, I'm finding myself still having to go to, the pharmacy and get medications for my family. And the pharmacy that I go to, everyone has been great. I mean, especially in the face of adversity, and I've seen it progress to, what appears to be normal operations to going there now and everyone is wearing masks, and they still have smiles on their faces under those masks. You can't see, but you can see it in their eyes, and they're providing great service. So I really commend at least the pharmacy I go to. Everybody has been fantastic. I have not felt an impact personally in terms of wait time, out of stock shortages, anything like that. So they've been fantastic in doing what they need to do to ensure that they're still providing the same level of patient care to all of their patients that they always have.
Yeah, thanks. So Darren, Susie, shift over to appointment-based model or to a MedSync model or to curbside or delivery. What are you both hearing and seeing are the major changes that took place mostly towards the end of March?
For where I live in New Jersey, there's more cases in my county. We have over 10,000 cases just in my county. I'm right outside of New York City, and every single pharmacy that I know in this area is just delivering, and everyone is posting in the local family groups, use this pharmacy to get your paper towels, use this pharmacy to get this, use this pharmacy to get your hand sanitizer. So I think a lot more people are talking about pharmacy just in their everyday, posting about it and things like that. So I think that's a big shift and something that I've seen with the deliveries that's really made it different, because where I live, there's really a big ban on anyone going out. The stores are, they count how many people are there. You have to wear masks to get into them. And so it's been extremely helpful that the pharmacies are all delivering.
Right. Yeah. Darren, what are you seeing?
Yeah, I mean, I second that. Really big, influx of delivery, not only from our patients, but also from our payer partners as well. So that's been really as a good partnership. I do think though, looking again, as we're moving forward into this digital age, apps and those type of things have been becoming more and more popular. Folks are, and I would say different population segments are coming in asking like, how do I do this? Meeting the patient again at their house. So if they want to call in to the pharmacy and talk to the pharmacist, if they want to use pharmacy chat, if they we expanded our drive-through offering, so it's not just for picking up of prescriptions and a few products now, 60 moving forward with curbside. So these are things, again, because of some of that anxiety for patients to go into the stores, or if they're not allowed to go into the stores. How do we meet that patient need? So I think that's really where we're trying to, we've been working on it, and now it's almost accelerating some of that work to make sure that we're meeting the patient.
Thank you for that. I'm going to pick up on something, that is a little bit of an undertone here, where we're talking so much about education, communication, trusted relationships, and folks thinking of the pharmacy as somebody they have a relationship with it they can trust. So, Susie just described New Jersey. She's in the middle of it, but there's lots of places in the country that maybe they've got one or two confirmed cases. They're being told, hey, we need you to stay at home. They're showing up at the pharmacy. Pharmacies maybe got some protective gear on, but yet their ED's not stacked full. Lauren, if I'm an independent pharmacy and I'm not going to pick Nebraska because they're starting to get it now, but in Western Wyoming, let's say, or Northwestern Wyoming, what's my role as far as a trusted source of education to sort of say to folks, hey, you can't see it around, right? But we have to be really careful. Yes, I'm in my mask or wherever, and I know this seems a little bit odd to you because you're not where Susie's at in New Jersey, but how do pharmacies educate the folks that are around them in the community as a trusted source of information when it maybe hasn't hit there yet, or it's hard to see it or taste, touch, and feel what's going on in other places in the country?
Yeah, interestingly enough, I talk to pharmacies across the whole country. And so I do talk to some that are in New York and New Jersey, and their responses are a lot different than, for example, like you said, North Dakota, Wyoming, places that some counties haven't even had a one confirmed case yet in some instances. And so to your point, the pharmacist is serving, as always, a very valuable resource to the community. And just some examples are the pharmacist is still encouraging restricting patients into the store, even though confirmed cases haven't been, the number of patients that are allowed in. And another example we've put up, and I say we because it was an owner that I just spoke to, she put up some educational information for some patients that may be coming into the store. Another example, they've restricted some access to come closer to the pharmacy area. As we've been seeing, there's more and more barriers coming up. And so utilizing those type of informational resources, speaking to patients when they are calling in on the phone. We've had some other examples where pharmacists have had connections with some maybe assisted living facilities, or maybe some of the elderly senior centers that pharmacy services. And they're also communicating with them to provide information of how important it is. So they're going way beyond just being a pharmacist or a technician. It's really the entire community, and making sure that that area doesn't turn into a hotspot for COVID-19 by providing that education.
Yeah, so it's really almost a public health service that they're providing in many ways in these rural areas, right?
That's right. That's right.
So, and competing again with the social media feed, like what Darren was saying with his own employees, you're doing that a lot of these rural areas, saying, no, this is A, real, B, we need to be careful, C, I know this feels and looks a little weird as I'm presenting it to you, but I'm doing it for your benefit, right? So I want to talk about timeline a little bit. So we heard about this end of last year, started to pick up in January, February, a lot of healthcare folks, public health officials started to get worried. We get into March, about mid-March, Adam Silver cancels the rest of the NBA season. And Tom Hanks, essentially in the same afternoon,
Yeah.
Diagnosed or as having, positive for coronavirus. And then life really changed for at least North America at that point, right? So all of a sudden, a lot of 30, 90-day fills, I've heard pharmacists increasing delivery by 400%, et cetera, et cetera. Now what I'm hearing out there anecdotally is we had this huge rush, and we're still on our regular cycle with refills and chronic disease model, but now our new prescriptions are falling like crazy. Let's talk a little bit about our brothers and sister care team members and what's happening out there in the ambulatory care space. Darren, your thoughts on what you're hearing or trends that you might see in a very large national chain as far as new versus refill? What I'm hearing is a lot of the new prescriptions are dropping because offices aren't open for regular things like getting rashes and ear infections, or that there's more limited access, or folks are staying home because we're telling them to stay at home. Where do we think we're going to be just from an operations perspective? Where are we at now? And then where are we going to be in a month or two or three?
Yeah, that's a really interesting question. We were talking about that this morning. We are hearing that, folks are staying home. Prescribers' offices or doctors' offices are saying, hey, listen, we're not seeing, patients for some acute needs. And so, now patients are utilizing other resources. So there are some, we are seeing some practices doing a little bit more on the telehealth space, or patients looking at the telehealth space. But it's definitely, we've seen a decline in patients being seen at physicians' offices. Now, the interesting piece is there are some physician groups that are saying, hey, listen, we're holding off till May. And so the question is, what happens at that point? Do we see an influx of patients coming through, or is it still going to be a dribble? And I think that's kind of dependent on what the pandemic looks like, not only at the regional level, but also at the national level.
Sure.
Yeah.
Susie, Lauren, are you seeing similar scenarios or thinking?
Yeah, I mean, that question just reminds me of that article. I don't know if you guys saw it, but what happened to all the non-STEMIs So, there were all these MIs, and now they're showing almost a 50% drop in the rate of heart attacks. I think that's just, it speaks volumes, as to what's going on with the entire country. The entire world has almost, seen that decrease in the heart attack. So I think it is impacting just the usual, post-MI medications that you might get. So I think there are, outside of even just the regular, even the other day, my daughter had a rash. I'm like, I'll figure it out. I'm going to treat this. We're not going to the pediatrician today. So I think a lot more of us are, trying to just do things at home. And I think the fear of infection has impacted that for pharmacies. But I agree. I think it, in time will tell if we have the antibody testing, and then those people with antibodies can go back to work. And, I think this will, it's too soon to tell, in my opinion, how this will play out.
Agreed. But Lauren, we're going to ask you to speculate. What does pharmacy practice look like 1, 3, and 6 months from now? Same as usual or different? In what ways different?
Yeah, it's definitely going to be different, because I think this pandemic is going to impact healthcare for a ways to come. This is so unique and something we've never seen before. And you're exactly right. Patients were coming in at the very start, wanted to get their 90-day fills, get their overrides. They wanted to stock up, rightfully so they didn't have to leave. And now we're seeing a downturn in those acute care medications for antibiotics, steroids, et cetera. And as we continue to push forward, we anticipate, as doctors' offices are opening back up, that those acute care meds are going to come back in, and patients are going to be, again, coming to the pharmacy to get those on a more frequent basis. But I don't think it's going to return to what it was before. As Susie just stated, patients now, they're calling their pharmacist to ask about a rash, and they've always done that, but it's just heightened now. There's more communication with the pharmacist on how to treat at home. And so pharmacists, they're actually busier in some ways, even though they're not handling all those acute meds. They're busier with the phone calls or the drive-through. We had a pharmacist that counseled a patient on a glucometer through the drive-through the other day, because these disease states aren't stopping, and we have to figure out ways to take care of these critically ill patients. And so 1 month, 3 months, 6 months, whatever the time frame may be, I think pharmacists right now are such an important part of this pandemic, that the hope is that states and at a national level, we're going to recognize that and give pharmacists even more importance in the healthcare setting, and more provider status in states as well.
Yeah.
Susie, thoughts on test and treat?
Okay. So I think, personally, I think it's a step in the right direction for pharmacy as a whole. I think as long as the pharmacists are provided with proper PPE in order to conduct the testing, I think that this all could be spun. This whole pandemic could put pharmacists, as frontline primary care providers. And I think, for the profession, it's extremely positive. So I think that's, it's really a game changer for us. I think the questions that pharmacists have really are related to the protection, and they're worried about that. But as long as they have the PPE, then they're ready to do it.
So Jeremy, if we could, you had this acute episode of your 6-year-old and appendicitis. What happens if that pharmacy had to close, or the pharmacies around you had to close? What would be your patient caregiver experience?
Yeah, I was just sitting here thinking of that, and to take a step back, one of the interesting things that the surgeon told me when he was first evaluating my daughter was that they're seeing a lot more cases of appendix cases that are perforated, because parents are waiting to take their kids to the doctor. They spike a fever. I mean, in my case, it's like, with everything going on, it's like I get a kid with a fever. I mean, no other symptoms, fever, and it's like, oh my gosh, what's going on? So even myself probably waited a little bit longer than I would have normally waited once I figured out, what was going on, to take her. But all of the support staff that I saw at the hospital, again, I don't think the layperson thinks about it. I mean, I work in healthcare, but I'm not frequenting hospitals, so I don't even think about it necessarily. But all of the people that help make that hospital function, It's not just doctors, it's not just nurses, it's all of the support staff, you know, and they were great. And obviously when you have a pediatric situation, kids are scared anyways. It's like they're having to watch and see everybody's in masks. They don't want to wear a mask. And it's hard to explain to a 6-year-old the concept of flattening the curve, right? Because they don't, that's not what they're understanding. That's not their level of understanding. So, you know, all the way through discharge and then having to go to the pharmacy to get her pain medication, you know, and of course it's a Friday, you know, appendicitis doesn't happen on a Tuesday afternoon. So, you know, it's Friday night and I have to get to a pharmacy, and my pharmacy luckily is there. You know, acute pain medication, filled it within an hour, along with the rest of their workflow. You know, got counseling. I mean, I just can't reiterate enough how they have stepped up to meet this demand. And it's not something that's flashy. It's not something that's out there in everyone's face, I don't think. Certainly not in a normal circumstances what a pharmacy does. But it hits you when I see a while back, a few weeks back, I saw a headline out of a newspaper in California, in Riverside, said pharmacy technician dead at 25. It's like you never see pharmacy technician in a headline. And it's just, when you see something like that, you know, it's just really makes it real. And, you know, makes me want to step up my efforts and my family's efforts to do our part with, you know, social distancing and whatever we can to stay in shelter and hopefully not spread this.
Yeah, so I mean, there's some really sobering topics and issues that get brought up, and one of the undercurrents here of a lot of this is, will folks see community pharmacy differently? The trend was, Darren, you know, over time, people are going to get their shoes in the mail, they're going to get everything's going to be online, everything's going to be telehealth, and it was really kind of two different ends of a spectrum, right? On the one hand, you said, here's a local community pharmacy where you get everything local, probably a couple blocks away for most Americans. And on the other side of that spectrum is I get everything by mail and somebody's logging in like we are now and providing some sort of service, and you don't need all that bricks and mortar. How will the COVID coronavirus crisis, if at all, but how might it change the thinking around, do we really need to make sure that we maintain 60,000 pharmacies on street corners across the country from a public health perspective, maybe even a national defense perspective? What are some of the ways that people might think about community pharmacy differently 3, 6, 9 months from now?
Yeah, I actually am very passionate about that. We have to continue to have pharmacies in the communities that we serve. It's just, I mean, I think this only reinforces it, right? So when you have a situation like Jeremy had with his daughter, he has to be able to have access to the medications in a timely manner. You know, when there is, one of the biggest things that I think that community pharmacy proves, and the pharmacist in particular, is that relationship. You have to have a relationship between that patient and pharmacist. And I think that's one of the biggest things where you have to have that physical presence within those communities. Not saying that we have to change and be flexible. And again, we have to, you know, I've said this a few times today, but meet the patient or the customer on their terms. But we have to, it one day might be deliver the prescription to their house or to their work. The next day he or she might want to come into the pharmacy to have a conversation about something. And so I don't know if it's an extreme either way. I think we have to have options, and we have to have it more from a patient backed approach rather than what we think is the right business model.
So Susie, Lauren, let's expand on that. So on the one hand, community pharmacy, I go to it, I pick up the med, I get counsel, I get my services there. Maybe I get test and treat there. On the other hand, it comes in the mail, and I've got a call center or a telemedicine, telepharmacy scenario. Might COVID coronavirus, I'm seeing this on the primary care doctors that I work with regularly and have been working with for a long time, is the interesting phenomenon that's happening now is a move to telemedicine, but a move to telemedicine being provided locally. And we've not really had that conversation. So what does it look like if my Walgreens pharmacy or my independent pharmacy 1 or 2 or 3 blocks away that I still have access to, I still maybe have a previous relationship or an existing relationship that was face-to-face, but I'm still be able to provide that convenience that everybody's shifting to. So really to everybody on the panel, if I could start with Lauren or Susie, what does local telepharmacy look like? And is that going to be a thing?
So I think we have to remember the demographics of the nation. First of all, we have, all of us here, we're extremely lucky that we have home offices, that we have internet capabilities, that we have cell phones. And when we look at the nation as a whole, not everyone has that capability. So telemedicine has been extremely important right now with keeping people at home and safely treating, the elderly again, or the immunocompromised, and finding different ways to do that. But again, we have to remember that while that may grow in importance, like Darren mentioned earlier, is there are patients that don't have the luxury of having even a steady mailbox to get their medications, or the capability of talking to someone, whether via phone or via computer. And so while I do think for certain areas of the population that may increase the telemedicine and the abilities, because now we're seeing that we are able to do it a little more successfully than I think we had thought, we also have to stop and consider that there are patients out there that need to be able to walk to their pharmacy or take a bus to their pharmacy. And that's the only interaction that they may have with a healthcare provider in a long amount of time.
That's a great point, Lauren. I think one of the things you're saying there, if I could, is telepharmacy's been around since AT&T was formed, is what you're saying, right? Like we still do that a lot with our patients, and it's local telepharmacy, literally, right? Mm-hmm. But Susie, can we imagine a time in the near future we say, look, we just increased our deliveries by 4-fold, and the way HIPAA works, the way I understand it, is there might be some waiver situations, particularly now, but can we get in the habit of my delivery driver drops off and then I've got FaceTime or some utility where I'm counseling them? I'm still local, I can still do acute fulfillment, I still have a relationship locally. But are we going to be looking at kind of some of these solutions emanating from this, particularly if we end up in an 18-month situation, not a 4 to 8 week situation, where the new normal becomes that we're using the internet a lot to interact as healthcare providers with each other and our patients, but that it's done locally as well.
Yeah, I definitely think that can happen, and it might happen, especially in areas that, we don't know how long this is going to last. So a lot of the pharmacists that I've seen, some of them have provided their cell phone numbers and their, or text messaging number, whether it's just even a different number than their usual one as well, just to provide access to their patients. So I know a lot of pharmacists are using that to counsel their patients, and it's been a game changer for a lot of patients and for a lot of the pharmacists, where you can just text your local pharmacist, whether it's a question or you need something delivered, and you can have a back and forth chat with the pharmacist. And I think that's really helped a lot of people. So if they don't have necessarily a computer and everything, everyone does have access to pretty much almost everyone has access to being able to text. And I think I've seen that done a lot in this area. And I think that's here to definitely stay.
Jeremy, what are your thoughts? Pharmacists are certainly important talking to their patients, but let's all be honest, if we've been in a pharmacy, we know that the plurality of discussions happens with pharmacy technicians who speak the local language and can meet patients where they're at. What are your thoughts as far as local telepharmacy, this idea of meeting the patient where they're at, but being in the community at the same time?
I mean, I think it certainly has its place. I think this is going to highlight maybe shortcomings that we may have in telecommunications, and maybe the equipment that we even have in all of our community pharmacies. But at the same time, I will tell you, I've never been on so many Zoom meetings. Even my kids, they're on Zoom meetings. And you haven't lived until you've got 16 boxes of kindergartners on a Zoom meeting, all trying to talk at once. So, for me personally, when I think about that, I value that that face-to-face interaction, if possible, with my pharmacist, my pharmacy technicians. You know, obviously technicians are oftentimes the first and last point of contact at the pharmacy. And I've been blessed over my 20-year career when I worked at a pharmacy, getting to know some really wonderful people, really wonderful patients, getting to know them quite well, looking forward to them coming in. And you know, to everyone else's point, sometimes for some of our patients, that's the only interaction they have, right? That senior day at the grocery store where all of them come in on Wednesday and they're doing their grocery shopping. They're also by to see their pharmacy, their pharmacists, even if they don't need anything filled, they're just having that interaction. So, you know, to Darren's point, flexibility. I mean, adaptability, having everything in place to do that is wonderful, and it can be great. And certainly, I think just in terms of regular flu season, I mean, let's not forget that thousands, millions of people around the world get flu every year that we're all passing around. I mean, if we practiced more telehealth, more telepharmacy kinds of things during flu season, how would that lower just flu transmission in general? So I think it's a really wonderful tool, but I also don't dismiss the value that I have with that face-to-face interaction with my pharmacy.
So maybe it's not an either or. Speaking of not living until you've got 16 Zoom boxes up, I've had to step away 3 times, and my poor wife, who's the actual head of household, has been trying to manage 3 little ones running around. She's on her own webinar as we're on this now, right? So we're all going through this. My 8-year-old's supposed to be in class, but it looks like the Zoom's not working for him right now. Susie, what is this doing to our mental health?
I know, it's just, you know what, I think we just have to embrace it. I think the best part about this is that, you know, when I was on conference calls back in January, my kids were acting up and, you know, being quiet. I'm like, shh, be quiet, muting everything, not letting anyone know my kids are right over there. But now my kids sometimes will come sit, my daughter will come sit in my lap. I have 5 kids, and like, you know, you'll hear my boys all like jumping in the background, and I'm fighting. I'm actually in my bedroom right now with the door closed, with it locked, because I can't even go to my home office because that's where they would find me. And my husband's on another call, you know, so it's just like, but I told him if someone walks in, you know, we got to just accept it. And I think mentally, you know, we don't need to apply that stress and pressure. Like if someone walks away, if somebody's kid's in their lap, if, you know, their kids are fighting, we need to just embrace it and, you know, and be okay with that. And we can actually see, what I've seen is that people are more productive, actually. People, you know, being able to say, yeah, my kids are right here. And, you know, you hear people screaming in the background. I think that that's actually, it's worked out better for a lot of us versus before, where we're trying to like hide and, you know, no one's here and I'm by myself. And, you know, I think embracing it, you know, embracing that a lot of us are wearing pants with a nice shirt, you know, embracing it.
I've got flip-flops on.
Exactly. Yeah, you know,
take advantage of it.
Yeah. So talking about it.
My feet have never been so happy for so long. Right. So yeah, maybe Jimmy Fallon taught us all it's okay. Maybe your kids can be the star on the webinar as well, right?
Yeah, I love that. I mean, I've definitely become more relaxed, like definitely more relaxed about stuff like that. And, you know, just not having that pressure of like, oh my God, I have to sit down with my kids 6 hours a day and I have to teach them. If this has shown me anything, and I was an adult education, community college level, I cannot teach elementary school kids. I will admit it. That is a character flaw, whatever you want to call it. I am not an elementary school teacher. So instead of getting stressed out, you know, just like we apply flexibility in the pharmacy, just maybe we don't need to learn or spend so much time on math, but maybe you should learn how to mow the grass or do your own laundry, or any other number of life skills that you could come away from this. And we'll worry about the math in the fall.
Yeah, you can imagine this big beer garden that's going to be in place when the yellow bus shows up, hopefully in the fall, for all the parents to get together, right? So, but let's talk, you know, on a more serious note, I was watching a self-produced video recently. I don't know if you've seen it, of a mother who's a ED physician in one of the boroughs in New York, and she's widowed. She's got kids at home. She is homeschooling them in the morning, because she's trying to be as good a parent as she possibly can be. She's going to 12-hour ED shift, going through all of that mental trauma of, you know, if you have a patient or two die a day normally, now you've got 10s, 20s more in a day of that trauma, and managing that where it's a different family circumstance, and how are you trying to communicate safely with family members. So going through all of that, Lauren, you work with thousands of independent pharmacies. Darren, you have thousands of pharmacies at Walgreens. What are we doing, or what's popping up when it comes to folks that aren't as fortunate as, you know, myself, where even though we're struggling here, as you maybe can hear, with trying to be a two-parent professional family with 3 children, there's a lot of folks out there in much more challenging situations probably than a lot of us on this panel. You know, as this gets out past 4 and 8 weeks of stay at home, what can we be doing for, or encouraging policy-wise, or for our workforces out there, for folks that just don't have a lot of options? And to Lauren's point, that maybe they don't have a lot of bandwidth, they don't have a secondary parent or caregiver or caretaker in the household. Maybe they've got an elderly person they're taking care of. How is it that they go on normally, and how do we support those folks?
Yeah, I think one of the interesting points that you brought up was that not everyone has that other person in the household to help them. And in some cases, even if they do, both parents are working, or they may be both physicians or both be pharmacists, or whatever the case may be. And so we've been really stressing to our teams the importance of, like Susie mentioned earlier, it doesn't all have to happen right now. If all you are doing is getting through your workday and taking care of your family, it's okay to get takeout every night if that's what you have to do for dinner for your family. It's okay, to Jeremy's point, to teach your kid maybe to mow the lawn instead of giving them a math lesson, because that's the chore that needs done today. And we're also teaching them to maybe give their staff even just 5 minutes. You know, recent suggestion from one of our business coaches was, you know, find a comedian and just find a short YouTube clip and take 5 minutes every day, bring your pharmacy team together and just watch 5 minutes of comedy, of something that's different and distracts your mind and takes you away for everyone's own mental health. And knowing that the teams have to go home and then start their second job all over again. And it's being understanding that shifts are changing. You know, we've had some people who have, again, as I mentioned, maybe they were full-time, now they're part-time because they just can't handle that full workload of being a parent, a full-time homeschooling parent, and a healthcare worker as well. So just some different suggestions, again, of just breaking the normal cycle of what happens at work, and then giving them some relief of maybe we don't come in at 9 a.m. today, maybe today is a 10 a.m. kind of day, so we can spend some time with the kids, and being a little more understanding of everyone's circumstances right now.
Sure. Darren, how do we take care of tens of thousands of workforce members, of which a subset of them have some unique challenges to show up and provide healthcare services, but at the same time, make sure that their family's taken care of and some semblance of normalcy with schoolwork takes place? It's not an easy thing, right?
No, not a perfect answer. I think the best thing is really, and I heard a few of the folks on the panel say it, is you don't have to do everything. You can't accomplish everything. You know, one of the things that we've tried to stress with our folks is take care of each other. If something gets pushed the next day, it gets pushed the next day. You know, make sure you're talking to your teams, making sure, you know, there's that, because some of these folks are, you know, single parents. And so they go from their job in the pharmacy and then they go home and have another job to do. So it's cooking or cleaning or whatever that looks like. And so just trying to make sure that they can kind of be supported. You know, we're fortunate enough to have some employee assistance programs and stuff like that, but sometimes it's just as simple as just having conversations with folks. And I think that's really the biggest thing, and having fun with your loved ones and your family members too. So it doesn't have to be always, you know, doom and gloom. So when I finish from work, sometimes I shut my laptop off and hang out with my 2 6-year-old and 30-year-old, and we're, you know, jumping around and playing games or whatever we're doing, Mario Kart or whatever that looks like that they want to do. just to take my mind and obviously their mind off of what's going on, because they're thinking the same thing. Why can't they go to school? Why can't I play with, my friend down the street? So the more that we can kind of have some of that normal time, I think is better for everybody.
So it sounds to me like one of the take-home messages from this webinar today from the panel is, if you're a pharmacy owner, if you're a pharmacy manager, it's not just your patients that you're taking care of in this time of stress. It's actually your workforce that you need to be mindful of as well. The communication, the attempting flexibility, and it sounds like the theme of the day is it's okay, right? Like, yeah. So Susie, maybe you can close us out with a song, if you would. No, I wouldn't do that to you. For healthcare providers and their families on the "It's Okay" front, what closing advice do you have for all of us?
Yeah, I mean, we've kind of covered it. I think it's okay. I think, no matter what, we just got to go with the flow and see what happens, and and accept what's happening too, and being able to embrace it, and, not expecting and putting that pressure on ourselves or on our spouses or on our children, or pretty much on anyone. We're all in this together. So I think we need to remember that, and be okay with that.
Yeah, and I think having the growth mindset of just doing things that you haven't done before. Myself, I'm a new practitioner to meditation. No idea if I'm doing it right, but I do take 3 to 5 minutes throughout the day just to breathe, do some meditation, and I found for myself it's helpful. So, I mean, I think all of this underscores to the value of employer provided wellness services, EAP services. I think a lot of employers have those things, and employees don't use them as much as they could or they probably should. So again, to Darren's point, those conversations with managers, just reminding employees, like, these services are here for you to use them. I think all of that can be really great for mental health. I mean, of course, physical fitness, physical health, all the things that allows a pharmacy technician to stand on their feet for 10 hours straight every day. So all of those things can help.
Well, that's a great point to close on. We know in biological systems that disruption leads to growth and evolution. So growth mindset, it's okay. Let's evolve. Let's get to a better place through all of this. I want to thank everybody for joining this Pharmacy Times special webinar on the coronavirus COVID-19 response out there amongst pharmacies and the pharmacists. And let's thank the pharmacists and the pharmacy technicians that are all on the front lines out there, particularly in a lot of these hot spots where they are being exposed and still serving their community. So thanks to Darren Dugry, Susie Solomon, Lauren Simcoe, and Jeremy Sasser for joining us. And maybe we'll see each other again, maybe we won't, but let's hope that we're all in a better place when we meet again.
Definitely.
Absolutely.
Thank you. Thanks
Thank
so
you.
much. Thanks. Bye-bye.